Well, good morning, everybody. And today I'm going to walk you guys through, as a paramedic level, how to enter your tickets and how to sign up for clinicals in Platinum. And again, this is probably one of the most confusing things that we're going to talk about but once you get the hang of it, it's very easy. But those first couple times that you do it, we understand it's a learning curve, and we're going to do that. And so we're going to go over that this morning and talk about basically what's going on with that. I can get my slides to advance here. So again, we're going to show you how to enter your data. We're going to show you how to in Platinum Planner, how to sign up for a clinical, how to show you how to clock in and clock out, and that's going to be kind of an important part. We're going to demonstrate how to put patients and patient skills into it, and we're going to talk about a couple of very specific things that you need to know about that will help you meet that 100% goal, which is eventually that's what we're doing all of this for, is so that we can improve to the state entities and our accreditors that, yeah, you guys have done what you're supposed to do. We're going to show you how to complete tickets, and then we're going to show you and provide directions in case you need a clinical return to you. Okay, because every now and then you submit your documentation. When you submit your documentation, it's not what it should be, and we're going to have to fix it. All right. So with that being said, entering your data. So our end goal at the end of all of this is that you get 100% on everything. And for those of you that don't know, there's about, I think about 600 things total that you have to do. It sounds like a lot, but again, just like eating any, if you're going to eat the whole cow, you eat it one bite at a time. And that's what we're going to do. But we're going to do all this in Platinum Planner, whether it be your labs, whether it be your simulations in lab, which do count for some of the stuff. Okay. And as we get into that, again, but the good news is that your instructor puts in all of the skills that you do in lab, okay? So that part's a little bit easier for you, but again, I'm going to show you, it's probably a whole lot easier to show you than it is to just sit here and talk about it. So let me bring up the old Platinum Planner here and bring it over to the recording area. Now, so again, this is what we're actually after, and I can tell you that I'm in my student view right now, and a lot of the times that everybody goes, well, how do I know what I want to sign up for? And again, BJ is going to go a lot more in detail with you guys. The clinical coordinator is going to go a little bit more into that detail. I'm going to switch to the calendar view though, because what I can do is say, hey, now I will tell you that a lot of the skills and labs are not yet built. And the reason that I say that is that, so again, they're not all built, and if they were built, then we would be able to see them in it. And again, if I switch to my instructor view, I'm going to switch there real quick. And so when I go to the instructor view and I go to calendar, you guys can see that there's a lot more of the, matter of fact, it's probably going to take a half hour to load. But again, these are all of the clinicals that are available to us. Okay. So you're going to be able to, and basically what it is you would actually just click on one of these as the student view, and you should be able to add yourself. It'll say, hey, this is open. Would you like to do it? And that's how you're going to do it. Now, and again, if you want to sort, I want to take all the labs out of it. I want to take all the scenarios out of it, and then these are just going to be so like anesthesia. Now there's certain labs that certain clinicals you're not going to be able to do for first semester. So again, you're not going to be able to go to the cath lab. You're not going to be able to go to the cardiovascular operating room. But you do have access to all of the ERs, and that includes freestanding ERs as well. Now, again, if you want one of those opportunities, all you have to do is basically say, hey, I'd like one of those students. Now, I'm going to go back to my student view here, and because I've already put myself on a clinical so that you guys can see actually how we're going to do that. Real quick before I start doing that, let's go back to the... So when you sign up for a clinical, just remember, once you sign up for it, it's yours, okay? And again, we understand things happen, schedule changes happen. And if it does, that's okay. But again, once you sign up for it, it's yours. All right. So it's going to take a lead instructor or higher, either myself, the clinical coordinator, or your lead instructor, to actually cancel you off of that clinical. All right. And I will tell you that once you say, hey, I'm taking that clinical, we kind of hold you to it. So again, I will tell you, last semester, this video is filmed in 2026. Just for the summer semester alone, we had 322 requests to cancel. That's a lot, and folks, that's a lot of work that we have to do when you do that. Okay, now again, BJ is going to go over that with you guys a lot more, who's our clinical coordinator right now. Might change before you see this video in the future. But again, your clinical coordinator is going to go over that. Now, before you go to clinical, make sure you know where you're going. I know that sounds dumb. We have the address, by the way, of all the clinical sites, but there's a difference between going to the address and knowing where you're going. So I would say make sure that you know where you're going. If you're going to go to the ER, you mean to make sure you know how to get to the ER. If you know to go to the OR, again, you need to know. And again, ask your lead instructor, ask the clinical coordinator. We can tell you kind of where these things are. Make sure you have a plan to eat, especially if you're on a night clinical. I would say kind of think of that ahead of time, and I would definitely bring snacks in your bag. You never know, especially when you get on the field ambulance rides, you never know when you're going to get to eat next. So I would definitely bring some snacks with you, some protein bars, or some again, something to kind of to cure the munchies in case something bad. You get that lovely 16-hour we're not stopping shift. Spare clothes, I would definitely bring a set with me, because you never know. We deal in a business where sometimes it gets messy, and I really don't want you to go around in nasty clothes when we have the ability to not do that. So definitely bring a spare change of clothes with you. As a paramedic student, I would hope that you've got a spare change of clothes available to you. Throw them in your backpack again. And then one other thing is since we are a little bit technology driven, as dumb as this sounds, you might want to go out and get you a charger, because you never know when you might not be able to charge your phone for a little while. All right. Well, the good news is you got the clinical. So again, you're going to be 15 minutes early. You're going to go to the main entrance of wherever that clinical is, or the fire station. Again, and you're going to clock in. And boy, I can't stress that one enough. And I'm going to switch back here, because that's what I'm going to do on this clinical that I'm actually assigned to right now. Is again, I'm going to go to begin documentation. And there it is. And it's even going to tell me right there, you haven't checked in yet. So go to your documentation, you hit check in, and boom. And by the way, this will geolocate where you are. Now, I will tell you, the college has got mine blocked out so that I can't actually show the position. If you do this on your phone, and you should be doing it on your phone, make sure that you put in there exactly where you clocked in. Because if anything, this is going to give everybody proof that you were where you were supposed to be when you were supposed to be. Okay. So again, I clocked in, and by the way, it's 7:20 when I'm making this video. I was supposed to be there at 7 o'clock. So it's going to show me clocking in at 7:24, which is okay, because I can go in and I can say, hey, I actually got here. Because again, sometimes things happen. But again, you do have the ability to edit this. Okay. Let's see here. My preceptor today was going to be, and by the way, when you're searching your preceptor, the less you put in there is actually better. But notice how it put a list in there. And so, hey, Natalie was my preceptor, and so I'm going to click on that. Guys, if you put in a preceptor and you need to put them in new, you can do that, but I'm going to tell you that a lot of our preceptors are already in there. And if I recognize a name that I know for a fact is in there and it's asking me to verify it, I'm going to send it back to you. All right. And I'm going to say, hey, nope, that one's in there. So how you search for them is you click on the hourglass, and let's say I put somebody I know that's in there, Bree Vogel. If I type in Bree, so it seems Amy O'Brien, I don't want her B-R-E-I. If I spelled his name right, it probably would work better. So look at that, Stephen Bree Vogel. Look at it. And matter of fact, he's in there twice. Again, Bree Zogel. So again, that's not him. And again, usually I'll go through and I'll clean up this list. But if I know that Steve was my preceptor that day, I'm going to click him. Your instructor, that is optional. Most of the time, you would just put your instructor that's in there. And for this class, it would have been Paul. Now, again, most of our clinicals, by the way, are not 4 hours. They're usually a little bit longer than that. So, by the way, it's going to ask me to clock out when I'm ready to clock out. So, just so you guys are aware. All right. So, back to the PowerPoint real quick. Again, when you go in, you're going to clock in. Make sure you clock in, and then go introduce yourself. And then if you're going into the ER or the OR or a hospital area, we kind of going to go to the charge nurse. If you're going into a fire station, you want to go to the lead paramedic, or you want to go to the station officer. And again, and they will give you an assignment at that point and tell you kind of the rules of the road. They'll usually say, hey, you're going to stick with this person all day long. Or they might even, especially in non-emergency rooms, they'll say, hey, you can just roam around and get what you need to get. Again, at this point, this is kind of like your green light to go forth and conquer evil. And you should, by the way. So, assessments. If you let the hospitals give you things to do, they're going to give you a bunch of things to do. And again, IV starts are great. 12 leads are wonderful. But what we really need to be doing is actually going in and seeing patients. And if you can kind of shadow the doc or the nurse practitioner as they're doing these things, it's going to help you do things a whole lot faster. And so if they're gathering information on this patient, this is a good time for you to listen, to watch, and maybe even when they get done, maybe ask some clarification questions. You're not going to find something out unless you ask the patient. Even when you do ask the patient, sometimes you get some interesting answers, okay? Try to get a hands-on assessment when it's allowed. Now, I'm going to stress this part. Don't get in the way of them doing their job. I can't stress that enough. If they are in the middle of doing a trauma assessment on a trauma alert, now is not the time for you to be in the way, okay? But again, if it's a critical patient, but you can gather your clues and gather your assessments based upon the findings that they get, okay? And again, skills are good, and skills are always good, and we should always take the opportunity to get a chance. So if they say, hey, get an IV on patient in room 5, go get the IV. They say, hey, the patient in room 7 needs to get a tetanus shot, which is an IM injection. Yeah, we should probably do that. Never pass up that chance to get these hands-on skills, okay? And that goes for reading the EKG. That is a skill. If you're getting a 12 lead, that is a skill. And we're going to show you how to enter that. Now, just remember, there's kind of 2 branches that I kind of go off here. There's the stuff in the emergency room, and then there's the stuff on the ambulances. For the emergency room, we're looking more towards you doing a good assessment, not necessarily where the patient's going to be ending up. But if you can get that information, that's wonderful. Usually it's either we went upstairs with them or they were discharged. Those are the 2 big ones or they're transferred out to another facility. So again, and then you've got the ambulances, and just so you know, mobile first response is what they call the non-transport rescues in Platinum. All right. Ambulances, again, you're going to try to finish your paperwork on every call as soon as you get done with the call. Okay. So once you get done, you're going to go back, you're going to hopefully have your device with you. You're going to enter all the data. All right. For the ER, you'd have 2 hours at the end of your clinical. So if it's a 9 a.m. clinical start, you have 2 hours to get your clinical stuff done. Now on your shorter ones like OB, you still have 2 hours, but respiratory or OR, those you're probably going to have to document after the fact, okay? So take your notes, again, write it down on your notepad. Again, don't sit there with your phone. If I see anybody doing this, I lose my mind. So I break my phone out and I'm yes ma'am, this is bad, okay? We don't want to do that in front of a patient, all right? Talk to your patients. They are human beings, all right? Please talk to them. Don't sit there and ask questions while you're sitting there going through the computer, okay? That bad form, we don't want to do it that way, okay? So take your notes and then you're going to go back and enter your data. All right, now we're going to switch back to Platinum again and pull up the old Platinum here. And let's talk about entering data. By the way, if you screw up and you didn't save the data, by the way, saving is always a good thing. And that button up here that says Save Changes. There's a button down here that says Save Changes. You got plenty of buttons to say Save Changes, okay? Now, I'm going to go in and I'm going to now document my patients. All right. Now, in order to document a patient, I have to add said patient. All right. So I'm going to go put in, and hopefully these are all ALS patients in. And today we just happen to see a lady that had abdominal pain. And I'm going to put a lady in there very specifically. Again, make sure you put the time in there that's the correct. We're just going to use this default. And let's say that is a 25-year-old female. And the reason I'm using 25, as you all know, this is a childbearing age female, which throws all kinds of different things. Patient has right lower quadrant abdominal pain. All right. And guess what? Now, you're always going to have these patient encounters. All right. So as a friendly reminder, there's going to be two types here, formative and competency. We always, I repeat this, we always do formative before we do competency. I want to stress that again. We always do formative. So if you've got a choice, even though you did a competent evaluation, we always do formative before competency. Trust me when I say you're going to have plenty of time to get these, okay? Now, I'm going to show you the back end here in a second to hopefully where this will make a little bit more sense. All right. So pathologies again, and we got to figure out what happened. Let's say that this was, we're trying to figure out exactly what is wrong with this patient. And when we did our thing, it looked like this patient had again, will it fit any of these things here? Again, most of the time, it usually will fit one of these categories. So try to pick something that's, again, let's say that this was a medical issue. Again, it could be other medical, neurologic. It's not neurologic. In this case, she found out that she was pregnant, okay? But being in the right lower quadrant, boy, we got a lot of things it could have been, okay? So again, we're going to put other medical conditions, and we're going to hit successful. And notice how it added that one down there below, all right? Now, the skills I performed, because, of course, we want to make sure that we did some skills. And again, so what happened? So the first thing I'm definitely going to add is I'm going to put a patient care report. Now, folks, there's going to be two types of patients, the ones you do assessments on and the ones that you just do skills on. If you just do skills on this patient, you don't need to put this report in there, okay? But if you're marking any type of assessment, you need to make sure that that's in there. Now, because we did an assessment on her, again, we're going to put that in there so that we can say, hey, we've assessed this type of patient, all right? Now, this just happens to be she's going to get really sick on us, it's just to let you know, all right? So these are all the things that we could have done to this patient, okay? Hey, we established an IV on her. Hey, I'm going to click on it. We established an IV. And by the way, there's going to be information that I need to enter on that. And by the way, if I need to duplicate that, let's say that we started 2 IVs on her, all I have to do is hit this clone button and it will actually clone it for me, okay? Now, again, now I'm going to also let you know, guys, that we did some really, this lady literally crashed in front of us today, okay? Because, and again, anything that we did to this patient, but remember, I performed an oral tracheal intubation. Boom. Look at this. I did it. Now, let's talk about attempted and observed, okay? We don't care about those, all right? We don't want to attempt it. We don't want to observe it. So if you see attempted or observed, we just don't want to do it, all right? Well, it stands to reason that if I intubated her, that I probably do this. Here we go. Positive pressure ventilation. If I'm intubating somebody, there's a good chance I'm probably going to bag them. So I want to definitely put that in there. Guys, make sure that you go through this list, and anything that you might have done to this patient, you need to put into the skills, okay? So anything that you might have done, make sure that you put that in there, all right? Now, I will also tell you that there's some other skills that, again, always look through this skill list to see what else is done. By the way, you can also have multiple pathologies, so just keep that in mind as well. So again, she didn't have it. Well, she actually, at that point, she turned into a respiratory problem or a complaint. So yeah, did that count? Yeah, we're going to put that in there as well, okay? So we can add all of these. Now, the thing is that, again, notice how it added that down here, okay? Now, once some of these things are actually going to have a form attached to them once we go to forms that'll be in there. All right. I'm going to hit save because, hey, we did this. And by the way, if I got in here and said, you know what, I'm not, for some reason, I want to delete the patient. I can actually delete the patient or I can edit the patient. Okay. So I can go back in there and say, hey, I need to fix this. Okay. But again, now, by the way, ages are important, and I'm going to show you why here in just a moment. All right. So now I'm going to go to forms. All right. So there's 3 forms. We're always going to do this one, the clinical preceptor evaluation. We're always going to do, I'm going to rate the preceptor is going to rate me. We're always going to do those 2 forms, always, ever. Now, I will tell you on most clinicals, there's going to be EMT ones. You, as a paramedic, do not have to do any of the EMT forms. Please don't fill those out. We could care less. You are not a paramedic, you're not an EMT student, you're a paramedic student. So, again, but this is a patient care report, so I'm going to have to do that one. And so I'm going to click on this. And I'm going to say, hey, I want to attempt 1, and I'm going to fill out the form. There we go. So, again, we don't care about the incident number, the time of the interaction. Again, we've already got that data, but we do have female and patient sex and chief complaint. Female patient having abdominal pain, and the dispatch chief complaint, again, if it doesn't meet that criteria, don't fill it out. Okay. And again, the patient, let's say, treated in transferred care. Again, this is more rigged for a ambulance run than it is an ER. Okay. So again, simply put all of these in here, put your patient age in there, 25. You can put now guys, you can put all of this in there. That's perfectly fine to do. And we want you to fill this out. Again, it was not a cardiac arrest, although it came close. But again, you didn't have to resuscitate the patient. Primary cause of arrest. This was a medical reason, so we're going to say respiratory for this because she did go into respiratory arrest for some unknown reason. We don't know why. Maybe we gave her a medicine that we maybe knocked her completely out, but that's why we intubated her. All right. Any type of safety equipment, we didn't use any of that. Did the airbags deploy? That wasn't applicable. Again, just simply go through here and figure out, again, these are more rigged towards but the part that's the important down here is the symptoms that the patient was having. So the patient was having, let's say she was having, primarily she came in and she was bleeding. And again, that's also a discharge, by the way. So primary symptom, associated symptom. Okay. Now, do you have to put NA on all the rest of them? No, you don't. Okay. But what this does is it actually counts. Let's say she had some nausea, vomiting. She definitely had some pain. And then again, did she have respiratory distress? Change in responsiveness? Yep, she sure did. Because if we're intubating her, she probably had a change in responsiveness. Again, swelling, wound, weakness, transport only. And the provider's impression definitely had an abdominal pain, but she also went into respiratory arrest. And so respiratory arrest, we're going to put as a secondary system. Did she have any injuries? Did death, cardiac arrhythmia, chest pain? All of these things may come into play. We need one primary, and if you can put a secondary, that would definitely help you. So again, let's say that we had given her 200 micrograms of fentanyl IV and procedures, ET tube. Again, these are great things, but you don't really have to do that. Vital signs, if they were pertinent, I would probably put them in there. The better the documentation here, the better. But the narrative, I definitely want to do. I want to, I'm going to type in my narrative. I will tell you that it's probably a good idea to, when you're typing in your narratives, I would highly recommend that you do them in, let's say, a word processing program like Word, and then copy it and paste it into Platinum Planner. Notice how I said you're pasting it into Platinum. The only statement I'm going to make is we can do not do that on EMS testing, but you're definitely welcome to do that on Platinum Planner. Or you can just sit here and type out your narrative. One other thing you can do is have a template and then have your template cut and paste. But I'm going to tell you, we do need a narrative on every patient, and I can't stress that part enough, all right? So I filled out all the report, and it looks good. I go back and I check everything and make sure that everything is in there that you need to put in there. The biggest thing again is that we are looking at that what it is that you would normally put in a report. Now you might want to use that patient. If that's the case, you hit delete and it's going to delete everything. If you need to edit it, again, you go in here with the edit button and you can edit it there. All right. Now let's go back up top. Remember, let's say that we documented all of our patients. Remember, if we put in 7 patients, and I will tell you that a good rule of thumb is when you're at the emergency room, 5 patients a shift is probably a good rule of thumb. I would say probably 7 to 8 just to be sure. That way, again, the more that you do on the front end, the less you got to do at the end. All right, but it comes time that we're ready to leave the clinical. So remember when I said that the clinical, they need to fill out the preceptor to student assessment form. All right. Again, when you come in, you're going to review the objectives that you wanted to do. And again, and I'm going to put my name in here. And there we go. Preceptor's name. Hey, I'm going to precept myself today. And then let's see here. And my title, I'm paramedic. And the clinical site and department again. And I was at Advent Bellevue ER. Look at that. It's already in there. All right. So this was a hospital clinical and the date and time and start of the clinical. And hey, I got to go in there and fix that form. Again, we just put whatever time that the clinical started. And then the preceptor is going to go in and grade you. 4s, again, 3s and 4s are perfectly fine. 2s and 1s, probably not good. If the, student was awesome, But again, your preceptor needs to fill all these things out. Again, they're going to put in your student performance. They're going to put all these things in here. Notice how if it's got a red, just like anything in platinum, if it's got that red tone to it, it has to be filled out. The student signature, and at this point, you and the preceptor are going to go over these things, and the preceptor is going to sign. Again, I'm precepting myself, so there we go. And by the way, I wouldn't try to fake that. I will tell you that it's really simple to send these to the preceptor and said, hey, did you fill this out? All right. Now, again, if the preceptor says, hey, you know what, I need the program to take a look at this. And this is something that we look at when we review the tickets. And if we see that check mark, we're probably going to call that preceptor. Okay. With that being said, again, this all looks good, and we really thank them. And your preceptor is going to hit the save button. And the reason that you're going to make sure that the preceptor hits the save button is because if now we go back and we try to edit it, I'm going to have a record that somebody edited it. And yes, we've had students do that. And if they do that, I can tell you right now, that's falsification of documentation and probably not good. All right, now remember that when they filled that form out on you, well, you get to return the favor, okay? So I'm going to go in here and say, hey, try Advent Bellevue UR, preceptor's name. Hey, look at that. And if I do, and, Roderick Paramedic, and let's see here. So, I mean, you can go in and put in and by the way, put your honest feedback on this stuff. And I will tell you that we do share this with especially if it's something we see a pattern with a preceptor. Again, everybody's entitled to a bad day, and we understand that. But I will tell you that if I see a trend or a pattern with preceptors, I assure you that definitely we will definitely note that. Hey, preceptor rocked. Hey, we like that. And again, the student signature, you're going to sign it again that, hey, I'm putting this down here. All right. We hit save, and then all of my stuff is done. Everything's got check marks, so far so good. All right. Now, when I get everything done with all of my paperwork, notice how that it's got all of these skills, and it's been adding these up for me. And we want them to add them up, okay? We want them to add that. All right. Now, as soon as I get all of this done, we're going to submit documentation. We click on submit documentation. Boom, have a nice day. Now, by the way, I can look and see, well, hey, where's my age group progress? Notice how I now have 1 pending. As soon as this gets cleared, it'll be able to put that in there, okay? Can I view my capstone events? Yes. Can I view what my clinical progress is? So I can actually go in here and say, hey, you know what? I got to still get all of these things done. Okay. So please take a look at that and make sure that, again, you've got everything done that you need to get done. All right. With that being said, we now go to, I've submitted it. So what you guys don't see is if I go in as the instructor, then I'm going to go in and I'm going to check these tickets. Okay. Hey, look at this. I have 2 opportunities that need to be reviewed. And by the way, there's something I did not do. When you finish, and I'm going to return this to myself, and actually I'm going to go in here, I'm going to edit it because I can go in here and edit it. So the other thing I did not do is I did not clock out for the day. Okay. So not only do we clock in, but we need to clock out. All right. So I'm going to open this up, hopefully, maybe sometime today. I'm getting the circle of death here. There we go. All right. And if I go to end, all right, and you know what? So I'm going to unlock it so that, I'm documenting why I don't want to unlock it. I want to go back here. All right. So info. All right. But again, I've already put my time out. So it probably, but usually it says, hey, I need to go in there and I actually need to clock out. Okay. And so there, it's going to tell me, hey, you need to go clock out. So if you see the button that says, hey, you need to go clock out, make sure that you go clock out. Okay. Again, it's already got the time in there, so you kind of got that already beat. Now, if you have to leave early for some strange reason, again, you need to go in here and tell it, hey, I clocked out at 7:46. Okay. Now, usually when you, again, I got there at 7 o'clock in the morning. I was actually only there for 46 minutes. It actually clocked me out because I said, hey, it was okay. And I submitted my documentation, so then it would do that. All right, now I'm actually going to, I'm not going to return it to myself because obviously what I'm going to do is just simply go to the opportunities and manage student documentation. And I'm going to go back up and I'm going to say, hey, you know, this looked pretty good, but I will tell you that because of what I'm doing here today, I don't want this to count at all. So the options I have is to approve it. Hey, this documentation looked good. I'm going to send it. I'm going to return it. I'm going to say, hey, I found something I didn't like, and I'm going to return it to you. But me, because I don't want this to count for anything, I'm going to need to say reject. And if I say reject, it's not going to give me credit for anything that I did on that clinical, okay? Reject is kind of a bad thing. And by the way, so I can, if I have anything returned to me, I can pull it up and say, hey, you know, this one's been returned, okay? And again, this one was a test one that I did. You know, I looked at it again and I'm going to reject it because I don't want it to count anymore. So if you actually go to return or reject it, and by the way, it will give you a message that, hey, your stuff was rejected. So again, I've rejected multiple ones of me, but I've had other people do things that they shouldn't have done, and we rejected the clinical or we marked them absent. You kind of want to stay out of this column if at all possible, because a rejected clinical means either you're going to take -5 off of your grade. If it's a no call, no show, you're going to take -10 off of your grade. And we'll talk about that in a second, but these are all bad. So if you just didn't show up for a clinical, but you were excused from that clinical, you need to get with your lead instructor, and the lead instructor will physically take you off of that clinical so that you don't have all the bad things happen because of that. All right. Now, back to our PowerPoint. We went over how to put things in Platinum. So again, make sure at the end of the documentation, clock out, submit your documentation, okay? All right, make sure that you got your evaluations completed. If you didn't get the evaluation completed, newsflash, you get to go find that preceptor. That might not be as easy as it said. So make sure that you get your evaluations before you leave. I would say probably 30 to 45 minutes before your clinical is over. Go talk to your preceptor, okay? Make sure that they get the signature. Again, name and title of that preceptor as well, all right? Do not have the secretary sign your paperwork. If the secretary signs your paperwork, I know the secretaries. Guys, don't have the secretary sign your paperwork. It needs to be at least the same level you're training at. Paramedic or higher needs to sign that, okay? And again, we want your feedback on these. Again, boy, when I walk in and I put the put the computer down in front of one of the nurse managers, and I show them the great feedback. And guys, we get a lot of great. I would say probably 98% of the feedback we get is like, "Hey, this really went well." But if there's things that didn't go well, we need to share that with those nurse managers, and we share them on a frequent basis. Actually, a little bit more frequent than you think. But I will tell you, we are truly blessed because we've got some really good preceptors, people that are willing to show you guys how to do things in these emergency rooms. And again, we've got some duds out there. We understand that, but I can also tell you, for the most part, our clinical sites really do look out for our students. And then when you help them, they're going to make sure to help you. Okay. All right. So again, evals, got to have one on every clinical. Fill out what you can. All right. And then have your preceptor sign it and then hit submit. Okay. Again, it will not be able to submit until everything's filled out that's required. All right. We kind of did that on purpose. All right. You screwed up. All right. So we do audit the reports and we may send it back to you. And if we send it back to you, you're going to find it in that returned column. And again, we usually put in there a time. You have 24 hours to correct. And again, if it's little things, it's going to say, hey, you got 24 hours to correct. And if you don't correct in that 24 hours, I just hit the reject button. Okay. So again, we try to give you, and again, the more that you can put notes down in if you've got, let's say you went on a trip and it's going to be 3 days before that, let your lead instructor know so that they can put comments in there so that they can say, hey, I've given the student, 72 hours to do this instead of 24. All right. The more you keep that line of communication open, the better. All right. Now, if it needs to be returned to your lead, if you need it returned, just ask your lead to do this to you. Okay. And this is okay to do. If you've actually realized you didn't put something in there, we want to make sure that you do all your documentation correctly. All right. Remember our no call, no show thing? That's -5 off of your grade. It's -5 if you just don't show up. It is -10 if you no call, no show. So that is a really bad thing to do. If you need to not be at a clinical, again, anytime before 7 days, we're usually going to approve that. But within 7 days, you got to have a pretty good reason for us to do that. All right. And get with your lead instructor. They're the ones that are going to actually take you off that clinical. All right. And so let's say you wake up and you're sick, and this does happen. And we don't want to share our germs. We don't want to spread our germs, especially in certain areas, especially like in the neonatal unit. We don't want to go up there sick. Okay. The little kids, they don't have an immune system yet, really. Okay. But kind of the rule is if you sign up for a clinical, you need to be at the clinical. Just because I decided to take a mental health day, no, that's not the way it works. Okay. You need, again, we usually, we do this on a case by case basis. And if you are quote unquote sick, we're going to say, hey, you need to bring us a note. Again, but I've had students actually come, I've actually gone to the clinical site and they were sicker than a dog. And I was like, load up, you're going to make this clinical up, but I'm not going to charge you for it. But again, guys, if you are sick, again, you need to let your lead instructor know. You need to let the clinical coordinator know. But again, you need to also, we're gonna kind of demand proof on that one. All right. Sometimes we have to leave a clinical, family emergency. You get ill while at the clinical. All right. But just remember that you are responsible for the time that you missed. Let's say you do something dumb and you are dismissed from a clinical, though. I will tell you that it's almost like that clinical did not happen. But I will tell you that I'm going to be involved in it directly, more than likely. Okay. Especially if you are dismissed from a clinical. And what I mean by that is you did something that you shouldn't have done. All right. Make sure that if you do have a time where you leave the clinical early, put it in the notes, guys, exactly why that happened. The more you put, the better, and probably the less on the back end that you're going to have to do. Because if I get a question and it says, hey, I spoke with Professor LaFleur, and he said that I could leave due to a family emergency, I'm going to click on OK. All right. If not, guys, I'm going to be asking questions. And again, It's questions we don't need to ask. Again, put your reasoning in there. If you do have any questions, because again, this is kind of a long video, 40 minutes here, go to your lead instructor, go to the clinical coordinator, and then you can come to the program manager. Okay, I can't stress that one enough. Lead instructor first. All right, that's always going to be your first point of contact. All right, that's it for this one. Good luck. And again, you're going to have questions, and that's okay to have questions. I want you to have questions. And that's what we're here for, is to help guide you to make you somebody that's better at documentation. All right, you're going to document on every call you do. I want you to remember that. That's a skill you're going to do every time. So please learn how to do it well. All right. Good luck all there. If you have questions, again, ask. All right. That's it for today. We'll talk to you next time.